We're going to have a little question and answer session related to insertion, bolus feed, and removal of the nasogastric tube. Questions, please.
Yes, I have a question. If your patient is hooked up to suction, what would you do first before removing the NG tube?
Excellent question. The first thing we would want to do is discontinue the suction and turn it off. We would remove the nasogastric tube, and then we want to be sure that we clean the suction machine. Remove it from the room if it needs to be removed, but we do not want to leave that suction machine with secretions in it. Did that answer your question?
Yes. And also, I have another question.
Okay.
Whenever you're removing the NG tube, is there a better way that you could protect yourself and maybe the clothing when you're pulling that out?
Excellent question again, because sometimes there are a lot of secretions that come out with it. So we've already moved this nasogastric tube, but if we can simulate that we're removing it, you can actually take a towel and wrap it around that nasogastric tube. As you pull it out, you're pulling it out. And I actually had a nurse tell me at one point in time that when she pulled the nasogastric tube out, it flipped up and she got some of the secretions in her face. So this is really an excellent suggestion. When you pull that out, you're protecting yourself.
Okay.
Another question.
Mrs. London, I had a
Yes.
question about skin care. If you notice that there's some excoriation, is there something that you can do with the tube to prevent further damage?
Are you talking about excoriation around the nose?
Yes.
All right, so what we want to think about always is what is the skin around the nose like? So even before we when we insert a nasogastric tube, before we tape onto this nose, we might want to clean this and dry it really well so that we know that tape will hold. Another thing we want to really always be aware of when someone has a nasogastric tube in place is what's happening with the skin around this nose. So if we begin to see excoriation around the nostrils, we can actually take this tube and tape it up onto the forehead. That's not unusual for us to do, and that keeps all of the pressure off of the lower portion of the nares. Oh, here's something else about that tape though. Sometimes this tape gets dirty and or wet. At any point in time, that tape can be changed and refreshed. Did that answer your question?
Yes, it did.
Yes. Another question.
I have a question. When I'm taking care of a patient with an NG tube that's hooked up to suction, am I supposed to empty that canister every shift as part of my intake and output, or what do I do?
At least every shift it should be emptied. And can your STNAs do that for you? Yes, but it would need to be measured. It's certainly appropriate for you as the nurse to do that also, to empty it. And think about it. You, as a visitor coming in, you don't want to be looking at this suction container getting fuller and fuller. Plus, you want to measure the output. So you kind of have to look at how much fluid you've put in. It's not going to be an exact, and you can always document what that drainage looked like. Did that answer your question? Or
Yes, thank you.
any other questions? Great questions. Thank you very much.